Hello again, and welcome back to our series on managing chronic pain during the opioid crisis. If you'll recall, we started this series after listening to testimony in Congress from multiple experts on chronic pain, as well as a patient who experiences chronic pain on a daily basis, a lady, Miss Steinberg, who not only has chronic pain, but also is an advocate nationally for improving access to treatment for chronic pain. She mentioned during her testimony the need for education in regards to chronic pain. And I think this was a pretty broad statement because not only did it mean education on how to treat chronic pain, but how to better understand, listen to, and hear people who experience chronic pain. Pain on a daily basis that decreases your function, that doesn't let you do the things that you want to do in life. Today, I want to answer some questions that have come up in regards to chronic pain. But first, I want to preface it with these responses are certainly informed by my medical training and the medical training that all the providers here at Javery Pain Institute receive to understand why we're offering treatments for chronic pain. But more importantly, these responses and our understanding of chronic pain is based on our understanding of you, the person with chronic pain, and what we hear from you, what we understand about your experience in living with chronic pain on a daily basis. It's so important to form the foundation of how you understand and then treat chronic pain with that mix. We have to know what the patient is going through, even if myself or other people who provide treatments don't experience chronic pain. It's all that much more important to hear your experiences and let that shape the treatment plan as well. So what does it mean to have chronic pain? Well, the word chronic means long-term. And typically in medical textbooks, around the 3 to 6 month mark, we start to think about it being long-term. And that goes for a lot of different conditions. But for chronic pain, especially beyond the 6 month mark, when you're suffering with pain from any condition, we call it chronic. Pain is just that, it's pain. And the definition of pain doesn't come from an MRI study. It doesn't come from any testing, although those things are important to inform us about what may be causing pain. It's your definition of how you experience those symptoms, the effect it has on you as a person. And it affects a lot of levels of the person. It affects your outward behavior, it affects your inward psyche, your spirit, your outlook, your interactions with others. And all of these levels are important to understand what makes up chronic pain, and that goes into defining it for you and your experience with chronic pain. It's important to understand that this is a condition that's managed over the long term, and oftentimes we aren't, quote, curing pain, meaning we aren't eliminating pain altogether. Sometimes we do that with some of our treatments. Most of the time, we are giving you treatments to help you to function better in the midst of pain. So this is a management strategy, similar to how you might take medicines for high blood pressure or diabetes. You're not curing that condition, but you're getting regular treatments to help you function, to be healthier in the midst of that. Pain is likely going to be with you most days of your life. Some days are going to be terrible, some days are going to be great. And that's the natural progression, the natural behavior of chronic pain. When you experience pain on a daily basis, you have to know how to cope with that pain, but also we have to know what treatments are best to allow you to improve your function in the midst of that pain. And here at Javery Pain Institute, we want to be a part of your team. We want to be a guide, maybe even a cheerleader on your team, somebody that helps you to function better in the midst of chronic pain. Our goal is to improve function, decrease pain, and help you to get your life back. Thanks for listening today.